We're back at McCawley Periodontics, and the last few times we were here, we talked about gum disease and then implants, and now we're going to talk about what?
We're going to talk about dental recession. So gingival recession, and what that is, it's when the gums start to recede.
Right.
So you've heard of people saying, oh, you're getting long in the tooth. This is what it actually is.
Oh, really? Is this something caused by gum disease?
It can actually be caused by gum disease. A lot of it is actually caused by overbrushing as well. So
Really?
that's something you need to be careful for. You want to make sure that if you're brushing, don't brush too hard, and we do usually recommend a soft toothbrush for a lot of patients as well. A lot of people like this, they start having sensitivity because the nerve is a lot closer to that area when you get the root exposed. So anything cold, anything hot, it can make you jump, especially if you eat some ice cream, you bite into it.
Right.
This is something that'll make that a lot less pleasant.
This isn't necessarily something that's only cosmetic. There is a benefit to this as well.
So here I've actually got some before and after cases where some people came in and they had quite a bit of recession here.
Wow.
You can see those teeth are much longer.
Right.
Some dentists tried to patch that right there, but that's kind of a Band-Aid over the situation.
Right.
It's not really a true fix for it.
Right, you can actually see the bottom of the teeth here.
You can see where the teeth end and the roots begin right there.
And how does your technique differ from the older techniques?
Our technique is called the Chow pinhole technique.
Okay.
So what that means is it's like arthroscopic surgery as compared to a complete cut open knee replacement type thing.
Right.
So in the past, what they ended up and did was they'd cut open the gums and then they'd actually end up taking a chunk of your palate to stitch up over that area.
Right.
And again, it's something that's painful, it's not very pleasant. You get good results, but it's not something you're going to be really raving about after. What we're able to do is more minimally invasive. So we come in with the pinhole and then we actually are able to free up the gums so they actually sag down or push up right there. And then we use collagen strips to actually bulk up the gums and thicken them up. And then we're able to get some good root coverage like that.
And what is the benefit to the patient of the pinhole technique versus the old technique?
Less pain is the primary one right there. Less pain, less discomfort. There's only one area that's sore as opposed to multiple. If you have to take pieces of the palate there, that's not pleasant generally. So
Yeah. Does that also make it more resistant to gum disease?
it is, because those thin gums, they don't really stick to the tooth very well. They kind of open up right there and they don't create a very good seal. So if you're not creating a very good seal, bacteria can get down there and it can cause issues like gum disease and more recession down the road. So what we can actually do is thicken those gums up and it creates a better seal around that tooth, and that's able to actually make it more resistant to both recession and gum disease.
So when it comes to gum disease, implants, or the reconstruction of your gums, you have everyone covered.
We have you covered.
And in this case, literally covered. Well, doctor, thank you so much for your time.
All right, thank you so much.